Hi, my name is Melissa Smith. I'm a medical assistant, and this is my job at Scheurer Health. So a medical assistant, there's two sides to it. There's a clinical side and a clerical side. So clerical is more of the check in the patients, check out the patients, do all the scheduling for testing, authorizations, those types of things. And then the clinical medical assistant rooms patients, does all the vitals, does the injections, EKGs, all the procedures that are needed to be done. I've always looked at a medical assistant as making the providers look good because you make sure you have all the test results that the provider needs for the patients. You make sure that all the appointments are scheduled according to their schedules so they see them in a timely manner. Making all the calls to the patients that maybe the provider wouldn't have to. Every day could be a little different. That's what I like about it because you never know. Because with the phone calls that we get, the patients walking in, you never know what you're gonna receive. So a normal day is that runs smoothly. You check in all the patients, then you check them out, you schedule the tests, you get the authorizations. Well, the reason I went into becoming a medical assistant is because I like to help people, and I feel like my job as a medical assistant, I do more of the scheduling, the testing that they need. So I feel like that's super rewarding when you get all those auths that are needed through insurances, and then the patients get the testing. It's just, that's what makes me happy. I like to help people, and I feel like that's how I do it. I think a big thing is insurance, because that's my job. Like I'm the clerical MA versus the clinical right now, so like that's huge. Like a lot of patients don't realize that you spend hours on the phone sometimes getting the authorizations that they need for the tests that they need. So I think that's huge because that's most of my day is getting those for patients. Nowadays, everything is dictated by the insurance, and if you don't get the authorizations, the patients can't have the testing, and then they don't get the care that they need. That's the thing about Scheurer. It's small still, where like everybody knows each other, and like everybody's super friendly, and they're all there for the same reason of patient care. That's the number one thing that Scheurer stands by, and I truly feel that. We are not just coworkers, we're family here. So we all rely on each other for day-to-day things, and not only just by what we do here in the office, but just an overall like support. We can come to each other about anything that we need, providers included. Sometimes I think people think like doctors, you can't talk to them, or like normal people, but if I needed somebody, they would be somebody I could call that would be there for us because we're all one happy family. I think that we make a difference as a team here because we are comforting in the way we act. Like coming through the door, like you open the window, you're like, how are you? It's not like, what's your name? And a lot of times we already know who they are. So it's, it's the friendly face. And I am impressed every day with the growth that Scheurer's taking, to be honest. All the new providers that we're getting with all the specialties, it's really amazing. I didn't really think that we would be where we are today all those years ago that I started. Because, just a small little hospital, but we have a lot of good things to offer. I would say if you want to help people, but wasn't gifted the knowledge to be a doctor, this is the way to do it. I always wish I could have been a surgeon, but that wasn't my calling. My calling was to be an MA and to help the providers that I work with. I'm Melissa Smith, I'm medical assistant, and I am Scheurer.